Welcome back to the EnergyMD podcast, where we help you resolve your long COVID and chronic fatigue syndrome naturally so that you can get back to living your best life. I'm Evan Hirsch. Today, I'm sharing my conversation from Dr. Patrick Porter's Brain Fitness podcast. In this one, we get into what long COVID really is, why your blood test can come back normal while you're still sick, and the toxic 5 hidden energy drainers that keep you stuck. We also walk through the 4-step process I use with my clients, why just treating the spike protein doesn't work, and the biggest mistake people make when trying to fix this on their own. Let's get into it.
Today we have a very special guest, Dr. Evan Hirsch, and I was on his podcast and I thought, wow, he's got some amazing information because there's a lot of people out there, and you might be one of them, that is suffering from long COVID, and a lot of people aren't even talking about it. It's like one of these mystery undiagnosed disorders that people have that they can't find any cure for. But you're going to talk about it today. And Dr. Evan, I'd like you to first just tell us a little bit about yourself, how you got into this, and what took you away from just prescribing pills and sending people on their way.
Sure. So yeah, first off, thanks, Dr. Patrick, so much for having me on. So, my story was one where I had chronic fatigue syndrome. I went from a conventional family practice residency program to learning about functional medicine and integrative medicine, holistic medicine, and I started my own practice in holistic functional medicine. And then over time, I just started getting fatigue. I started getting worse. I got body pain. I got really bad brain fog, sleep issues. And eventually I was napping underneath my desk every single day, locked my door because I felt so much embarrassment around the fact that I couldn't take care of myself, and I was already practicing functional medicine, and I could help, 95% of the people who walked into my clinic, but I couldn't help myself. So I was eating, I was gluten-free, dairy-free, I was meditating, I was replacing all my deficiencies in vitamins and minerals and hormones, and my lifestyle habits were good, my sleep habits were good, all that, and I just couldn't get better. And so I went on a journey, essentially, of finding all the causes that I could. I knew from my training that if I just found all of the causes that I possibly could, that could cause the fatigue and the other symptoms that I had, that I would get better. And so I read every book that I could. I went to different conferences. I saw different providers, and none of the providers that I saw could help me, whether they were conventional or integrative or functional. And so I was really kind of like on my own, which was really hard. And so I went through this process, and I came up with what I can call now the toxic 5. So this is a combination of heavy metals and chemicals and molds and chronic infections and nervous system dysfunction or trauma that builds up in the body over time, that eventually there's some sort of trigger which ends up putting people into chronic fatigue syndrome or some sort of fibromyalgia, some sort of chronic inflammatory illness that then they're struggling with. And so I wrote a book about it. I got better by addressing each one of these causes. And then we were positioned well to help people with long COVID when this all happened, 6 years ago, because long COVID is chronic fatigue syndrome, except with a different trigger, a different name, a couple different nuances to it. But the reality is that the toxic 5 are still present that need to be addressed.
Yeah. So if you're out there right now wondering, hey, my blood test comes back right, I'm doing everything right, you might even get good oral reading scores, all these things are happening, but you still have this mysterious illness or this disorder in your body, you found some things that can possibly help, and that's what we're going to go into today. So tell me a little bit, first of all, what is long COVID? Because people know back in 2000, 2001, people were talking about COVID this, COVID that, but people are still having these symptoms of COVID even 5 years, 6 years later.
Right. Yeah, so long COVID is a syndrome that comes from exposure to the spike protein. Whether you got it from a clinic or whether you got it from a virus. The reality is that you oftentimes, and it's going to present in different ways. So sometimes people get viral symptoms, so runny nose, fever, loss of smell and taste, cough, something like that, and then their symptoms persist. Now, there can be over 250 different symptoms that you can get with long COVID. So it's pretty much any new symptom, especially any weird symptom that you may have acquired since 2020. Now, there are some people, like I said, who get viral illness or they get the jab and then they get subsequent symptoms. And there's other people who, who don't get any symptoms at all, but maybe their partner or their daughter did. We just had somebody new who just joined our program who has a pretty classical presentation. This is actually a physician. And his daughter had gotten a virus. He did not notice anything, but then all of a sudden he started getting weird symptoms of different kinds of neuropathies. He had some gut symptoms, he had some visual symptoms, etc. And they all kind of like spiraled out of control. So sometimes you can get that. Sometimes you can get a viral symptom that goes away and then comes back months to years later, where all of a sudden now you have a bunch of really weird symptoms. So a lot of it is the chronology of, any new symptom since 2020 that is a weird symptom that you've been struggling with, that you're going to see a bunch of providers and you're not having benefit. You have to consider that it could be long COVID. And by definition, it's, having one of these 250 different symptoms, with the big ones being fatigue, brain fog, body pain, sleep issues, loss of smell and taste, that have lasted for longer than 2 months.
Why is the body not able to clear out these spike proteins? What's happening in the body?
Yeah, so you have to have an intact and somewhat functional immune system in order to provide that barrier of defense. When you get a viral illness, your immune system should have a strong response. You should get, fevers and runny nose and all these different ways, maybe some diarrhea, all these different ways that the body is trying to get the virus out. And that comes from the immune system mounting a reaction. I was just on the call with somebody who said, you know what, I never get sick. Well, that's not really a blessing, because basically viruses are coming into your body and they're just skirting around the immune system because the immune system is distracted. So to answer your question, when the immune system is not functioning right, it's distracted by one of the toxic five or a combination of those. So heavy metals, chemicals, molds, infections, nervous system dysfunction, or trauma that has built up in the body over time, all of those will cause immune system dysfunction, and then your immune system is not going to help you get rid of any virus or spike protein that comes into your body.
These toxic five that you're talking about, back when I was growing up in the 60s and 70s, of course, people weren't living as long because they according to the maps, because babies were dying, earlier and things like that, so skewing the numbers. But what's different about today rather than the 60s and 70s and 80s, when nobody had heard of these things, these mystery symptoms?
So a lot of it has to do with our exposure to toxins. There's been studies done to show that there's over 300 different chemicals found in babies' cord blood, right? So that means that we're coming out of the womb already with a bunch of toxins and infections. And then they accumulate over time. I grew up in the 80s. We didn't know anything about pesticides or herbicides or glyphosate, and these just kind of accumulate in the body. Over half of the buildings in the world have water damage, and most of those have molds. These mercury fillings, which we call silver fillings because it doesn't sound good to call them mercury fillings. Every time you bite down on those, you're inhaling mercury vapor. So those all kind of accumulate over time, and then all of a sudden there's some sort of trauma, whether it's mental, emotional, or physical. Maybe it's moving into a place that has mold. Maybe it's a divorce, or going through med school or residency like it was for me, having relationship issues. Whatever it is, puts stress on the human organism, and then all of a sudden it kind of tips you over into having these symptoms. But it really is that buildup of the toxins over time. Right now we're exposed to about 90,000 toxins on a regular basis, 300 to 500 before we leave the house in the morning, right? From all the products and the nanoparticles that we're putting on our faces right now with the cosmetics and whatnot, that then get deeper into our bodies and our tissues. That causes immune system dysfunction and nervous system dysfunction.
Yeah, there's been a lot written about that our daily lifestyle is actually killing us, and the quick fixes that everyone's finding here. So when you think about what you've put together, because you have EnergyMD, it's a method that you resolve this long COVID and you treat chronic fatigue syndrome. And I can tell you that we see it. I mean, I hear from my doctors all the time, wow, I don't know what to do. These people don't have energy. Their mitochondria can't absorb energy, can't transmit energy. They're kind of at a loss as to what to do. So tell me a little bit about what this 4-step program is all about.
So the first step is to make sure we're addressing all the causes that an individual has. So part of my journey and what I found is that there's over 30 different causes, and that everybody who has long COVID or chronic fatigue syndrome has 20 plus causes. I had all 30. essentially. And so we want to make sure that we're not missing anything, because when somebody goes to see a provider and they feel like they've done everything, they've done laboratory testing, the laboratory test comes back, says you don't have something, you don't treat that thing. And if you have that thing, but the lab test was faulty for whatever reason, then you're just not going to get all the way better. So a lot of people, they see different practitioners and they address a number of these causes, but then they plateau. So we want to make sure that we're addressing all these causes. And, you know, the longer I've done this work, the less I test, you know, and part of it is because, you know, what I've seen over the last decade in doing a lot of testing is that over the course of a year, that the heavy metals, all the toxic 5 come out. The heavy metals, the chemicals, the molds, we can't test for the nervous system dysfunction besides the ACEs or whatever. But, and then you've got some good testing I know that you can do. But all of those, you know, there's problems, and we can kind of get into all the problems with the laboratory testing. And so we, by default, I know if I'm going to address 99% of the causes of something, I'm more likely to have success. So that's just what we do in our program. We're going to address the toxic 5. We're going to address adrenal gland dysfunction, mitochondrial dysfunction if people have fatigue, because those are big players. But then we're looking at, okay, do we need to address B12 deficiency, thyroid deficiency, vitamin D deficiency? What are people's lifestyle habits like? What is their mindset like? So there's some of these causes that we're just going to address, and then there's these others that we need to assess. So that's the first step, is to assess all the causes. Any questions on that before I move on?
No, that's pretty thorough. I liked it.
So then the second step, and I should back up and say, when we're looking at all these causes, we're looking at a combination of deficiencies and toxicities. So deficiencies are things that are not in the body that are supposed to be there. These are vitamins and minerals and hormones, lifestyle habits, mindset, and mitochondrial function. And then the toxicities are the toxic 5 and EMFs and traumatic brain injury. And so in step 2, we want people, so spoiler alert, I should say, this process is all about getting to the toxic 5 in step 4. But you can't go directly there, because you're just going to feel worse from having a Herxheimer reaction or die-off from killing something or pulling something out of the body, and the body's not ready. So let's
explain that to people, because they might not understand what you're talking about there. When you say they'll get worse, because most people, that's why people say they don't get sick. They think that's a good thing. We should have a little bit of a cold every once in a while to just clear out our system and things like that. But tell them what's happening there.
Yeah, so a Herxheimer reaction or a die-off reaction is basically when you are killing an infection in the body or removing a toxin from the body, you can feel worse if your exit pathways aren't open. So we're talking about, and this is what we do in step 3, is we open up the exit pathways. So the liver, the kidney, the lymph, the neural lymph or the lymphatic system in the brain, the gallbladder, the intestines, like all these pathways have to be open in order for you to pull toxins and infections out of the tissues or the organs where they're living and get them out of the body. Essentially, I think of it as kind of like a funnel, where when you're dumping things into the bloodstream or into the lymph system or whatever, the bottom of the funnel has to be open. So you need to make sure that, and this is, when people are doing detoxifications, this is the hope that what those products are doing, but inevitably, unfortunately, they're not. But you have to make sure that you have those pathways open. Otherwise, when you pull toxins or infections out, they're just going to recirculate and go into a different part of the body. And so if you feel worse when you are killing something or pulling something out, you should stop what you're doing. Or you should get guidance, because this is what I call the die-off dance, where basically as you're pulling something out or you're killing something, you have to pivot back from step 4 into step 3 to open up those pathways up some more, so that then you can remove those toxins and infections out of the body at a rate that the individual's body can tolerate. Because if you're feeling worse, it means you're not tolerating the treatment, and you have to individualize it. You have to personalize it for you.
Yeah. Now, when someone comes to see you, and we're going to get to how you know if you can help them or not in a bit, but when they come to see you, do they have to be right there in your location, or do you work with people all over the world?
So I'm all over the world. I'm not personally, but my program is. And so in 2018, I went online only. And part of that was, seeing that there was a lot of people that I really needed to help, and that I wanted to, once I realized that I didn't have to prescribe anymore, that everything that I'm using is, 100% natural, vitamins, minerals, hormones, etc., herbs, that I was able to help people across state and national lines. Unfortunately, when you are licensed as a provider in a particular state, you can only practice in that state. And so then you can't help people beyond that state. So, making that transition was really helpful for reaching more people.
Right. What do you think the big block is for some MDs that they don't want to look at natural remedies? If it's not in their PDR or whatever, they don't even think it's real. Like when you talk about chronic fatigue or fibromyalgia, there's still a great number of people in the medical world that say those are just mental things. They're not real. What's your response to that?
So I think that a lot of it has to do with your paradigm and what your mentors did and did not do and how they're training you. Like when you're indoctrinated through 4 years of medical school and then another, 3 to 6 years of residency, like you come out and you're excited to start practicing and you start practicing, and depending on what field you're in, sometimes you have success and sometimes you don't. And so then you're looking for the latest in, treatment and research that's coming out, but you're staying in your lane. Yeah. The people who go into this, and I kind of had a little bit of this as well, but when they go outside of conventional medicine, it's because they have to. It's because they're not getting success in the conventional establishment, and so then they have to go outside to try to find different options. And then when they see those things work, then they're like, oh my gosh, more people need to know about this. I got better from this, and I want to help other people do the same. And a lot of MDs also think that there isn't research on these articles, but I've put some of the research on my website on the toxic 5 and how it relates to long COVID, and the toxic 5 and how it relates to chronic fatigue syndrome. And there's over 100 different research articles on each one of those articles that I've written. So, that's all research that has been done. The research is out there. The research is on these herbs. But if you're not looking at that research, instead of saying, I would encourage these allopathic physicians, instead of saying that doesn't exist, there isn't research there, say, I don't know what the research is. Maybe I'll refer you to a naturopath, an integrative functional medicine doc, in order to be able to get you the support that you need. Right. But they're doing the best that they can. Yeah. It's just a different paradigm.
Yeah, and I think that a lot of them are basically not in healthcare; they're in sick care. So you're looking to make people well, and that's a different type of medicine, if you will, than trying to get somebody out of. I mean, I wouldn't want to be in any other country than America. Here, U.S., when I'm sick, if I have a broken leg or need a surgery or something. I've been all over the world, and I think we have some great sick care interventions. But when you ask them about wellness care, they're like, well, we got to send you home. We need another test. You're not quite bad enough yet. Get a little worse, and then we can do something with you. So you've found a solution, and we're going to put a link to your book too. If we don't have that, please get that to us, because I'd like to link your book so people can learn more about that. Because right now, fatigue, people with low energy, it's probably the number one thing that our doctors talk about. How can we increase their energy? We're kind of in an energy economy, if you will. So when you test these things, you have these 5 tests or however you test for these things. What's going on? How do you do that remotely? I mean, because they're not coming into your clinic drawing blood or something like that, or.
Right. Yeah. I mean, so there are a couple of labs that I like to see, the B12 and the thyroid, vitamin D, but really the big ones are ones that people don't think about. So I want to know if somebody is living in mold. So doing a mycotoxin and a spore test of your home is super important as part of our program. The other one is getting a cone beam CT test. Which is basically looking at whether or not you have any hidden infections in your jaw. Now, this can be done by a biologic dentist, though not all biologic dentists do it. So those are all tests that you can kind of do, wherever you are. And then, like I said, I don't really test anymore for the heavy metals, the chemicals, the molds, the infections, and the nervous system dysfunction. We just treat those because I know that those are the real root causes from what I've seen. And that kind of comes back to what you were saying about the allopathic physicians, the MDs, and their paradigm is that their prescriptions can decrease the symptoms, but the question is, do you want to reverse your symptoms. And if you do, then you're looking at the real root causes. And so that's, there are laboratory tests that we can send out to people, and sometimes we do it towards the end of our program to make sure that we've addressed everything. But the reality is that whether or not a laboratory test comes back and shows that they have these causes, we're going to treat them anyway, because the laboratory tests are highly imperfect. And we want to make sure we're not missing anything, so that when they're done with our program, they can say, okay, we know that we've addressed anything, and we're a lot more likely to be better.
That's right. So do you, beyond your program, then they have the knowledge base to maintain it on their own, or what's happening?
Sure. And we also have what we call a vitality circle, if people want to keep me in their back pocket moving forward so that they can ask me questions. We never kick people out of our world. My goal is to provide value to people, and they're with me for as long as they find that support. But, we have a 12-month program. Sometimes it takes people 18 months or 24 months. But, at 12 months, generally they're going to be 60 to 100% better. And then those numbers increase, where, beyond that, so then you're about 87% of the people have significant improvement by 18 months, and then it's even higher at 24 months. So it's really just a question of how much of these toxic 5 do you have in your body, and then what is the rate that you can remove them that you can tolerate, and so slow and steady wins the race. The body likes small changes. If you have sensitivities, it's going to take you longer because you're not going to necessarily be able to tolerate the treatments as well. You're going to need more nervous system retraining support, some more brain tap, and the nervous system retraining takes a while, and so it doesn't happen overnight. Oftentimes we see magical things happen with the nervous system retraining, with brain tap or some of these others at 6 months. Usually maybe it takes 9 months or 12 months, but how much trauma do you have? What do you believe about the world? What is your mindset like? Are you living in gratitude? All of these things, it's so hard to address the other toxins and infections if you don't have those things from a nervous system retraining perspective dialed in.
Yes, exactly. Now, when I went to your website to look at things, you have quite a few people on there, obviously talking about how help them in their program and that. So can you share some for our listeners so they understand? Maybe they can kind of fit themselves in. They might not know, it's kind of like that frog swimming in the boiling pot. It doesn't know that it has these problems. It just loves the water, and it's doing the backstroke until, one day they find out that they have these issues.
Right. Yeah. So, we have almost 100 testimonials on our website, just collecting the last couple of years. Let's talk about the physician who just joined the program, just a couple of months ago. So this was an individual who was in their 50s, male, was healthy for the most part, didn't really have any issues. Daughter got sick. All of a sudden, then he started getting some weird symptoms. He started getting some eye tics and some visual changes. Then started getting some SIBO-type symptoms, constipation, digestive symptoms. He ended up getting worked up locally, and then went to the Mayo Clinic and found that he had some autonomic nervous system dysfunction, but anal rectal manometry and some of these other tests were fine. Also was noticing that there was an increase in anxiety. A lot of people don't realize that new mental health diagnoses are common with long COVID. There was one study of 265,000 people who got COVID and 6 months later had a new mental health diagnosis. Usually depression, anxiety, sometimes bipolar or schizophrenia. But oftentimes people don't realize that COVID can kind of cause this sort of picture. So this individual joins the program. They get started, depending on how sensitive they are, will determine kind of how what the plan is that we give them. They fill out an online intake form. I assess it. I provide them with a plan within 7 business days that tells them exactly what they're going to be doing for the next 6 months, how we're going to address each one of the causes that they have, what laboratory tests they need to get, where they need to go to get them. We have them walking through a curriculum, and generally what the picture looks like. Since I'm using somebody who joined recently, I'll combine it with somebody else who's already had the success in the program. So oftentimes, what we're looking for is how your body is reacting to treatment. This actually tells me more than any lab test does. So if I'm using a particular therapy to address adrenals or thyroid or mitochondria, and you notice an improvement when you introduce that, because we're introducing one new thing every 4 days, changing one variable at a time. Then we can actually see what's happening. And so we introduce something, we see that you're noticing a benefit, you're not having a side effect, you move on to the next line in the spreadsheet, introduce the next thing. That tells us whether or not we're fixing that cause and how you're doing in reaction to that cause. So they're slowly improving, introducing the step 2 deficiencies, the vitamins, the minerals, etc. Energy goes from like a 3 out of 10 to a 4 out of 10, maybe a 5 out of 10, maybe some less crashes, where 10 is ideal energy. They're a little bit able to function better in their daily life, maybe able to work a little bit better, able to adjust their diet if they need to. Then they go into step 3. They continue to introduce the supplements, opening up. Now we're using more tinctures in step 3 and step 4, opening up the liver and the kidneys and the lymph and the neural lymph and the gallbladder and the intestines, making sure they're having a bowel movement a day, etc. No real change happens in step 3. The magic happens once we get into step 4, usually around month 9. We're introducing tinctures to address each one of the infections, whether it is viruses, yeast, bacteria, Lyme co-infections, parasites, spike protein. We're addressing the heavy metals, the chemicals. We're addressing molds. We're making sure they're not living in mold. And slowly and surely, by the time they hit month 9 in the program, that's really where the magic starts happening. So imagine if you're not noticing anything until month 9 in the program. It's really hard to kind of get your head around that. But the reality is that you didn't get there overnight. This is decades in the making. And it takes 6 to 12 months typically to get each one of those toxins and infections out on their own, to get rid of heavy metals and chemicals and molds and all the different kinds of infections. And so generally when you start treating for the step 4 products at around month 4, you've been on them for several months, around once you get to month 9, and that's when really the burden of the toxins and the infections comes off of the nervous system, comes off of the immune system. You've been doing the nervous system retraining the whole time. And so that's really when we start to notice the improvement. And so that's why generally people are 60 to 100% better at 12 months. And if they need more time, they just continue on. Our program gets cheaper the longer that you're in it, because we know this is not cheap. And so you keep moving through until you've gotten rid of all those toxins and infections. You're working on your nervous system. You've achieved new levels of personal growth as part of this whole process, using it really as a spiritual path. And that's when people get to 8 out of 10, 9 out of 10, 10 out of 10 energy. And then they have all of this knowledge around environmental medicine, these different causes that they can take with them moving forward for the next 50 years of their life. So essentially you're investing your time, your energy, and your money for a year or so that you can have, the rest of your life be what you want it to be.
Yeah, my dad used to tell us all the time that nobody talks about, they always talk about the cost of the education, they don't talk about the expense of the ignorance. So when we think about that, when people make mistakes, there's a lot of people out there, their Uncle Bob says this, their Aunt Kelly says this, whatever, and they're doing all these things for long COVID because everybody has an opinion, right? So
Right.
What have you found is the biggest mistakes people make when they try to do this on their own?
So I would say it's just addressing the spike protein. It's just addressing COVID. So a lot of people are like, let me try nattokinase or bromelain or curcumin or this, that, and the other thing, this latest treatment, and let's see whether or not it's helping. Oftentimes it's because your immune system can't get rid of the spike protein because of the toxic 5. So the stage is already set. The spike protein was the trigger. And so those are the people that we really see where they feel like they've done everything to get rid of the spike protein and they're still not better.
Right. So if someone's watching up to this point, congratulations, thanks for being with us. How do they know that you can help them, or how do they find out if this is a program they can use to help their fatigue or to get rid of these spike proteins and get their body back going?
So I recommend that people go to fixyourfatigue.com, and that'll take them to my latest masterclass. They can watch that and see if my philosophy jives with theirs. And then they can apply for a free call with me where I'll do an assessment. It's an hour-long call. I'll determine whether or not I can help them. About a third of the time, I tell people I don't feel like we're a good fit to work together. So it's not a foregone conclusion. I'm actually on that call looking for reasons why we should not work together. because it's not worth your time, my time, your money, our energy to have you into my program if you're not going to be successful. You know, my business runs entirely on referrals, testimonials, and so if you don't do well in my program, I do not want that, you know, to be out in the world. And so I want to make sure of that. And so, you know, I'll do an assessment to determine if I can help you. If I do feel like I can help you, I'll let you know, and then we can kind of talk about what's included in the program and all that. And I try to be just really transparent with people so there aren't any surprises, which is why I talk about our program being a 12-month program. Well, it's a lot easier to sell a 3-month program or a 6-month program, but that's not transparent.
Right. Yeah, I believe in the 1-year program. When I had my franchise, we weren't doing the same thing you're doing. We were doing addictions, and they had to sign up for a year. Because that 21-day number that people hear about all the time, that's never been proven in science. It's just a number people thought about. You need to live that life. You need to be under the stress of your life and make those changes over time. So I'm a big believer in longer is better. And we had a 1 year after that. Most people took the 1 year after it too, because you've got to learn to be your new self. I mean, not only physiologically but psychologically, you got to remember, because you've trained yourself to think that you're this person that has all these different disorders, instead of getting the body to do what the body knows what to do to heal if you get the interference out. What is your thoughts about there's big news out there right now. When I go to these talks, I go all over the country and the world and hear these speakers, and some of them are great, but a lot of them are speaking now about cellular communication, you know, like the body cell signaling and things of that nature. How does that play a role here?
Yeah, it's incredibly important. So oftentimes cell signaling is really coming from the health of your membranes. You know, and your ability for the electrolytes to kind of come through the membranes into the cell, and then messages that can be sent between cells. And so those membranes are phospholipid membranes, especially, you know, when we're looking at the mitochondria, plays a big role, because the toxins and the infections will damage the membranes of the cells, especially of the mitochondria. They'll take over production of the mitochondria, the mitochondrial DNA, and end up causing problems. So, you know, part of that communication that has to come back online, you have to not only repair the mitochondria and the cell membranes, but you also have to remove the toxins and infections from damaging those cell membranes and the mitochondria in order to get back to real health.
I want to circle back to something we were talking about earlier, because a lot of people think, hey, I got my lab test back. I'm in great health. I guess I just have to live with this. What are some flaws you see in those tests?
Yeah. So, you know, first off, it's like, are they doing the right tests? You know, when you're looking at these 30 different causes, are they actually testing for all 30 different causes? In general, it's going to be no. The other thing is that what's the challenges with the test? So if we're looking at some of these toxin tests, and we're looking at like heavy metals, chemicals, or molds, which are typically done in urinary tests when you're talking to integrative, naturopath, or functional medicine providers, the test is very much a test of excretion. It's not a test of your total body burden. And the more toxins and infections that you have in your body, the less able you are to remove them, the less able you are to excrete them. So then guess what? You've got a test that doesn't show up with anything in there. So they're like, oh, you don't have heavy metals, chemicals, or molds. We're not going to treat those things. So then those things just stay in your body and they don't ever get treated. When you're looking at infections, and you're looking at usually a serology test, which is your immune system's reaction to an infection, you're counting on the immune system being functional to have a reaction to that particular infection. You're doing the Western blot test or the ELISA or something like that for Lyme disease, or Epstein-Barr virus, or IgG, IgM, IgA testing. And so if your immune system is dysfunctional because you have toxins and infections in your body, it's not going to give you an accurate read. And then once again, if it shows up as being negative or normal, then you're not going to get treated for it. And so I've been fooled enough times to be like, okay, these tests are imperfect. I just need to go ahead and treat these toxic 5. The other thing too, in terms of the blood testing, is that oftentimes there is a normal range and then there is an ideal, optimal, or functional range. So if somebody has low thyroid, let's say, and they have all the symptoms, but their provider is just running a TSH, and they're not running a free T4 or a free T3, or they're running a free T4 and a free T3, but their ranges are very narrow, then they potentially are not going to pick up on somebody having an abnormal lab test. So once again, if the doctor does not believe that you have an abnormal lab test, they're not going to treat you, even though your body is screaming that you have low thyroid. And so, in medical school, even in conventional medical school, we're taught that 90% of the diagnosis comes from history and symptoms, and that 10% comes from physical exam and labs. But yet, when we get out into the real world and providers start practicing and they lean so heavily on their lab test, I tell them that if you lean too heavily on your lab test, you're going to fall over. Because the reality is that they're not getting accurate information, and then they're not doing a good service. They're not providing a good service because they're missing a lot of diagnoses because they're focused too much on these imperfect laboratory tests.
When I'm listening to you, it's very different than a lot of the MDs that I talk with. Obviously, I think I told you that on our call. If I was to line up 100 doctors, how many of them do you think have the knowledge you have that they could help their patients out in the same way?
Are you talking about conventional docs or
yes,
conventional?
Like most people think their primary care physician is the soothsayer. They know everything in the universe, and whatever problem happens, they go visit them, and they refer them out a lot, of course. But if they say, "Oh, you don't really have a problem, just take this prescription or whatever," how many actually do you think? Obviously we can't really know, but I have a good idea. But in your opinion, because people are going to say, I love my doctor. Well, you could love your doctor, but they might not have the knowledge that they need to help this problem. If you're not getting the help you need, you can still love your doctor, but you need to find a practitioner that's going to help you. So when somebody's out there going, I would say it's less than 10% of the doctors have the knowledge you have that work with people.
I would say 0% of conventional doctors, and because this is not anything that I learned in med school, right? And so if they're really conventional, then they're just going off what they learned in medical school and residency and the conventional literature. So they won't be practicing any of this. In terms of providers who are naturopaths or integrative docs or functional medicine docs, I would say about 1 to 5% of those, because most of those providers, they're not specialized. The thing is that if you have a problem with your car, let's say you have a Saab. I had a Saab back in the day, an old 92 Saab. I would try to go to somebody who worked just on Saabs, right? I'm not going to, and I'm not going to take my car that has a problem with it to my piano teacher.
Right.
If I want to learn how to play piano, I go to my piano teacher, right? I don't try to learn from my mechanic, right? You have to see a specialist. You do not want me doing your heart surgery, and you do not want your heart surgeon trying to treat long COVID and chronic fatigue syndrome, right? So it's just really important to remember that those people are going to have tools from seeing and doing every single day with that specialization. Right? And so for these naturopaths, integrative docs, functional medicine providers, most of those are generalists, and they don't ever have to step into addressing all of the toxic 5 because they can get 95% of the people better. I could, when I was practicing functional medicine, by addressing lifestyle habits and by replacing deficiencies, maybe 90% of the people. But you can help out a lot of people just by fixing their diet, making sure that their lifestyle habits are good, they're sleeping enough, and that you're replacing the deficiencies that they have. But it's this other subset of people that haven't been helped, that are frustrated, that have kind of gone through this process like you're talking about, from conventional to more specialized, until they actually realize, oh, you mean I have long COVID and there's actually specialists in this who can help me, and that's all they do? That's really the wake-up call when people are going to have more success.
Yeah. We're talking about energy and bringing the energy up so the body can do what the body does best, heal itself. The brain and body know how to do that if it has the energy resources. But we have these hidden drainers. And you talk about the 5 hidden drainers. Just kind of go over that a little bit so listener understands. Sometimes it's not what you're going to do now, it's what you got to get rid of. Sometimes you got to, you don't wear your shoes you wore in kindergarten when you're a high schooler. So sometimes you got to get rid of the old patterns and the old processes. So tell us a little bit about the 5 hidden energy drainers.
Yeah. So, when we're talking about the toxic 5, when we're talking about the heavy metals, it's mercury, it's lead, there's lead dust that's found in, homes that were built before 1970. Oftentimes the lead paint was just kind of painted over. The mercury that we get from our fillings, we also get from seafood. So, anything that's really from coal plants and their vapor that settles over the oceans, anything that you eat out of the oceans right now, and the bigger the fish, the more mercury they have in there. I've heard of people getting really significantly mercury toxic from being on swordfish diets or tuna fish diets. Up here in the Pacific Northwest, we have king salmon, which is the biggest one. That's going to have more mercury than something like soho. And that's going to have more mercury than something that's going to be smaller like sardines or anchovies. When you're looking at cadmium, that comes from smoking, whether it's firsthand or secondhand smoking. When you're looking at the chemicals, like I mentioned, there's over 90,000 different chemicals that we're exposed to on a regular basis, and about 300 to 500 before you even walk out of the home in the morning. These stats aren't supposed to overwhelm people. It's just to make you realize that you're exposed to a lot of these things on a regular basis, and what would it be like to filter your water and filter your air and eat mostly organic food so that you're getting less pesticides. Like, that can be really significant for your body, and drinking 2 to 3 liters of water a day to flush out your body and to stop exposing yourself to these cosmetics and these soaps and etc. that are causing damage. And then all of these infections, whether you've been bitten by a tick, whether you've kissed somebody over time, whether you've been bitten by a mosquito, all of these things are going to increase the total infection burden that we have in our bodies. In this form, as a human, we actually are 90% bug cells and 10% human cells. It kind of blows people's minds, that that's the case. But the reality is that we have this symbiosis until the heavy metals, the chemicals, and the molds kind of like take over, distract the immune system, and then all of a sudden these infections can become opportunistic. And then, like the molds that I mentioned, half of the buildings in the world have water damage, and most of those have molds. If you're seeing mold, then that means it's a real problem. Oftentimes it's there and you don't even know it until you're actually doing the testing. And then the trauma that we all experience. A lot of people don't think that they have trauma. They're like, I don't have trauma. I wasn't physically abused, sexually, emotionally abused, verbally abused, or whatever. But the reality is that if you were raised by imperfect parents, even though they loved you, and you had imperfect humans as your siblings, and you had imperfect peers, like all of those interactions that you have. I mean, those were my interactions. I was rejected by peer groups a couple of times. My parents are trying to get their needs met. My siblings are trying to get their needs met. My needs became less important. Like, it's incredibly hard to get your needs met when you are part of a sibling group. Even if you are you're a solo child, you're an only child, your parents are still, they're working, they're trying to get their needs met. They've got relationship issues, life is stressful these days. Everybody has trauma. It might be little t trauma, not big T trauma like this abuse, but it's really important that you make sure that you're addressing all of these 5 energy drainers. And especially, I can't overemphasize, and I know that your audience knows that from listening to this, the nervous system dysfunction, the trauma is so important. So using a tool like BrainTap is essential.
Yeah, we tell people if you don't get out of sympathetic drive, or sympathetic lock, as I like to call it, the body's not unlocked to heal. And if you're constantly under attack, and people don't realize that, they think, when my brother he went to school as a physics teacher, and when he came back one day, he says, odor has mass. That changed our whole world. So your body is actually metabolizing that. So there's so many things out there that people don't understand and realize. So when they come to you, do you have any common things you hear just when somebody calls you for the first time that you kind of say, oh yeah, it's kind of like these are questions that everybody asks. Is there anything like that you can think of?
Well, people are always oftentimes they're looking for like what the next treatment is. And I try to encourage them, to focus on what their causes are and doing that. But people want to know, like, have you helped other people? Mm-hmm. And what is your process like? Have you gone through the same thing? Like, do you have the empathy? And so those are the questions that are really important for people to get answered is, how do you know if somebody can help you? Well, have they helped other people like you? Right? Do they have testimonials, video testimonials, like real testimonials that are showing the transformation that people have? Do they have a lot of support going through the program, not seeing your provider like every 3 months? We guarantee a response to questions that people have in our program in 2 business days. Mm-hmm. People can get face-to-face time with me 3 times a month on group calls.
Mm-hmm.
We have one-on-one calls just about every single month, whether it's with me or with my health coach. Like, there's a ton of support that we provide in this program because there is a process. Like having the experience that I have, continuing to tweak the program based on the feedback that I get. This really is like a spiritual journey for me because like I get to work on myself, I get to learn about myself, I get to learn about other people, I get to tweak my program. But those are the questions that I get a lot where it's like, yeah, these are really good questions that you should be asking every single practitioner that you see. Make sure that if you have long COVID or chronic fatigue syndrome, that they have all the support, that they have the success, and that they're addressing all of the toxic 5. And if they're testing, you have to be cautious because you have to ask them the question, well, what happens if this heavy metal test comes back negative? Are you still going to treat me? And if they say no, then you need to be looking elsewhere because I can tell you that you've got heavy metals in your body, but they may not show up on a laboratory test.
Right. That's very intriguing. Now, as we wrap up the show today, what did I forget to ask you about that's super important, that's in the back of your mind, or what do you want to reinforce if I've asked you everything that I needed to?
Well, I think I would just, give people some support with some practical tips. Drinking, 3 liters of water a day, incredibly important. Mindset work, do your gratitudes, have a vision every single day for what you want your day to look like and what you want your health to look like. Say affirmations, really feel them, and ask yourself empowering questions. If you're asking yourself a question like, why is this happening to me? Your brain is a goal-achieving machine. It's going to go out and it's going to look for answers that really aren't going to serve you. But if you ask yourself, how can I love myself more today? How can I love my partner more today? How can I take a baby step in my health today? Like, those are really empowering questions that can really change your life. So focus on the mindset work. Keep moving forward. Make sure you're focusing on your causes, on the toxic 5, and I have no doubt that you'll be successful.
That's great. With BrainTap, we have so many users, but when we look at the usage, so many people we have about 5 tracks on eliminating negative thinking, but they wouldn't tell anybody that. But because they get to do it in the privacy of their own home, they work on it because people realize that they have this we have a negative bias toward life. I mean, that's just because our ancestors were actually survivors, so even if you don't have trauma in your life, your ancestors did. And MIT just proved that their DNA is actually bleeding through ours. So right. When you heal yourself, you're healing your next generation as well. So congratulations on what you're doing. We're going to get this out to everyone. The links that we talked about will be below. Please, he's offering a free consultation, and you can call up. The only thing you have to lose is your problems. Give him a call. If it's not going to work, he's going to tell you that. I think that there's no better solution than that. I mean, usually I don't know a doctor in my town that says, hey, come on in here for an hour and I'll talk to you, or 30 minutes or whatever, even 15 minutes. They're going to say the cost of my time is this, and then they're going to say I can help you, I can't. They're not going to do it for free, and you can't get in this week.
Right.
It's so bizarre that because of what's happened with this problem, and nobody's really diagnosing it as long COVID. They're just saying you have this problem or that problem, and then they're chasing down these symptoms, and then they find out, okay, I dealt with that. What's going on? So you've heard here today someone here who has a program, the EnergyMD program, that you can get involved in. It's free to join. Go to the bottom, click on the link. Give them a conversation, what's going on. It's a full spectrum program. It's not just like throwing darts at the wall and seeing what happens. It's not like my brother fixing my car. Let's change the spark plugs first. Let's do this. Let's do that. It's like, let's look at the whole thing. Let's get the whole thing running right. So congratulations. Thanks for being on the Brain Fitness Podcast, because if you're not fit physiologically, you're not fit mentally. And like you said, people who have these long COVID disorders, they're finding out that they have mental disorders as well, because your physiology and your psychology follow in step. They're not separate. These are not separate systems. They are unified. So we need to get these systems to work together. So please, if you liked it, if you're listening to us this far into the podcast, please like the podcast below. Share it with anyone you know that's having trouble. And even if they don't have trouble, they might not be telling you about it. Share with them that there is a solution. His book will be in the show notes too, so you can read the book. I'm sure it's available on Amazon and every other place you can find books. Go there, read about it, learn. Education he's giving you education for free to see if it even works. I think the worst thing to say is that maybe you know what it is or what you're going to do, or you're going to try to do it on your own. We need help. I find experts when I need help, because when you're the one who's cooking the meal, you don't know you forgot to put the salt and pepper in. You got to have somebody else reminding you. You get so busy. So congratulations on what you put together. I love your website. It does show that you help people. They're willing to share their story. It does talk about your support systems. So go there, check off all the boxes, give them a call. Let's see if we can help you get some energy, because we do live in an energy economy. So thanks again, Dr. Evan, for being here. And those of you listening, thanks for being part of BrainTap Nation. And we look forward to bringing you the next guest.
So if you have chronic fatigue, whether it's from long COVID or chronic fatigue syndrome, go ahead and click the link below to watch my latest masterclass, where I go deep into our 4-step process that has helped thousands of others resolve their symptoms naturally. After you watch that video, if you're interested in seeing if we're a good fit to work together, you can then get on a free call with me. All right, thanks so much. I'll see you over there. I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening, and have an amazing day.